Presentation manuscript on information retrieval and AI utilization in the medical field. Slide 1, Introduction. Hello, everyone. Today, we will systematically consider information retrieval and reliability assessment in the medical field, as well as the potential of AI. The structure will be as follows. First, we will briefly review the situation in non-medical fields. Then, to understand the situation in the medical field, we will organize the basic knowledge to ensure everyone has a uniform understanding of EBM. Finally, I will state my personal view on the usefulness of AI in the medical fields. In the final part in particular, I want to show that the approach to information gathering and judgment by AI differs greatly depending on the level at which medical practice is conducted. Slide 2. Characteristics of information retrieval in non-medical fields. First, let's organize the characteristics of information retrieval and reliability assessment in non-medical fields. In general fields, such as marketing, public information tends to be evaluated as reliable. Google searches and internal databases are useful, and now AI tools like DeepL research are also emerging. However, from a medical perspective, reliability assessment is still quite lenient, which will become understandable in the later slides. In other scientific fields, databases are sometimes underdeveloped, making searches difficult. Graduate students and others often judge peer-reviewed papers as highly reliable, and evaluation criteria are often loose. This is where AI becomes extremely effective, saving a significant amount of time. Thus, in major general fields, the benefits of information gathering and evaluation by AI are so great that AI has become this popular. The problem is whether these evaluations hold true in the medical field. However, in the field of medicine, where transparency is key and even the slightest mistake is unacceptable, the same cannot be said. I will explain this rigor in an easy-to-understand way. Once you understand this rigor, I believe you will see how precarious, non-objective, AI-based searches and evaluations of paper reliability are. That said, this does not deny the use of AI for intermediate efficiency, as human effort is ultimately necessary. Slide 3. Definition of EBM. Regarding the use of AI in medicine, whether a discussion is productive depends on how closely our understanding of EBM and other concepts align. Therefore, for a while, I will explain EBM, clinical practice guidelines, and systematic reviews to unify our understanding. The definition of EBM is the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. Slide 4. The 5 steps of EBM. EBM consists of 5 steps: ask, acquire, appraise, apply, and assess. Slide 5. The 3 principles of EBM. Many people know the 5 steps, but not the following 3 principles of EBM, so I will explain them. Optimal decision-making requires the best evidence currently available. It is necessary to assess the reliability of the evidence. The third is on the slide. The point is that searching in EBM is done with an emphasis on efficiency. Since you search for systematic reviews first, searching directly on PubMed is more reliable and avoids hallucinations compared to using AI. Also, if no systematic review is available, usable non-randomized studies are used, and for rare diseases, case reports may be more useful. However, in all cases, an evaluation of reliability is essential. This evaluation, however, should be something that can be done quickly, such as with a checklist. It should be noted that unreliable clinical practice guidelines also exist, but as well-crafted guidelines have become more common, they are now often consulted before systematic reviews. As a point of caution, the field of cancer is special. When a phase 3 trial is presented at a conference, it becomes the standard of care, so information from conferences is also necessary. Slide 6. Definition of a clinical practice guideline. Next, let's also confirm the definition of clinical practice guidelines. Clinical practice guidelines are statements that include recommendations intended to optimize patient care that are informed by a systematic review of evidence and an assessment of the benefits and harms of alternative care options. Those that do not follow this definition are unreliable clinical practice guidelines. Unfortunately, many guidelines created by academic societies are also unreliable. A simple way to distinguish them is to check whether they follow the GRADE approach, which is a principle for creating reliable clinical practice guidelines. Slide 7. Procedure for a systematic review. The definition of a systematic review is difficult to understand in words, so it's better to look at the actual procedure. Systematically, a clearly defined question, a research question in PICO format, is decided, a pre-specified plan is created, and after a comprehensive literature search, an objective selection of studies is performed. Then, as a reliability assessment, the certainty of evidence is evaluated using a method called the GRADE approach, and the results are integrated, meta-analyzed, and summarized. The point is that, unlike EBM, searching in a systematic review requires a comprehensive search, and the reliability assessment must be objective and rigorous. Slide 8. About the certainty of evidence. Let's explain the certainty of evidence in more detail. Without understanding this, it's impossible to understand reliability in AI. Now, if the variation in the results of each study was as shown in the figure, even with the same 1.62, which one, the right or the left, has higher reliability and certainty? Slide 9. Definition of certainty of evidence. The definition of certainty of evidence is hard to understand. Is the effect estimate calculated from the data truly within a meaningful range, even considering various factors? And can we confidently say it clears a clinically meaningful threshold? To put it simply, you just need to understand that. Clearly, the certainty of an effect estimate of 1.62 is higher when it comes from the well-aligned studies on the right, not from the scattered studies on the left. Slide 10. Factors that lower the certainty of evidence. Summarizing the factors that lower the certainty of evidence, 5 have been clarified. This results in an objective and rigorous evaluation. Risk of bias in each study, inconsistency between studies, indirectness, discrepancy between the study and the clinical question, imprecision, which is error due to a small number of cases in the study, publication bias, which is the hiding of unfavorable studies. This is also one of the evaluations in the GRADE approach. Slide 11. Relationship between systematic review and meta-analysis. In summary, until now, the relationship between systematic review and meta-analysis was described as in the diagram. Currently, the middle part, which also includes the circle of certainty of evidence, is required. Slide 12. About the reliability of systematic reviews. Here is a summary of what I absolutely want you to understand. Have you understood from the explanation so far that just because it's a systematic review doesn't mean it's reliable evidence? First, poorly conducted systematic reviews are out of the question. Even in a well-conducted systematic review, the certainty of the evidence for the effect estimate in the meta-analysis can be high or low. Of course, if it's low, the use of evidence is limited, and only when it's high can it be said to be reliable. Now, is such an evaluation possible with AI? For example, even if a paper states, "This is a reliable systematic review," Can you trust it? It's like a fraudster saying, I don't lie, but scientists shouldn't take it at face value, right? In that case, can AI automatically evaluate it? In reality, it would be difficult for AI to perform such an evaluation. The only ones that seem reliable are systematic reviews published in the Cochrane Library or the BMJ. But even some of those are questionable, which is a problem. Slide 13. Summary. Evaluation by AI utilization level. Even if an AI deep search says it has selected important papers, it seems very difficult to perform these evaluations accurately. Is it useful when it says, I used AI to find 100 important papers and created a detailed report? It's not useful, is it? With the explanation so far, I believe most of you now understand EBM, clinical practice guidelines, and systematic reviews. And unfortunately, you've learned that even things called clinical practice guidelines can be unreliable. You also learned that even reliable systematic reviews can have low certainty of evidence within them. I will repeat what I said at the beginning. In the fields of medicine where transparency is key, and even the slightest mistake is unacceptable, things are different from marketing or searches in graduate school. I hope you now understand how precarious, non-objective, AI-based searches and evaluations of paper reliability are. Now, let's revisit the 4 levels presented at the beginning. When not practicing EBM, many people are prone to taking information from famous sources or speakers at face value. For these people, AI has added the option of just doing a quick search with AI and being done with it. When wanting to briefly research a non-specialty area, previously one would consult books, the internet, clinical practice guidelines, etc. AI search will be very useful for this purpose. When practicing EBM carefully, previously, up-to-date, PubMed, and critical appraisal of original papers were necessary. This will not change. This is because, when using AI, while it can enhance efficiency and supplement searches, even a single hallucination would be detrimental to the patient. Also, the latest papers might be missed, or papers will often be selected where the reliability has not been assessed with the rigor of the GRADE approach for certainty of evidence, failing to meet the standard for patient application. For example, no medical professional would trust a study just because they are told it's reliable because it's a peer-reviewed study, or it's reliable because it's published on PubMed. When conducting a systematic review, AI should be actively used for things like preliminary searches, but full automation is still considered impossible. Much research is being conducted, and we can be hopeful, but the final confirmation, as in any field, is done by humans. Especially in this modern era where AI has become widespread, patients also gain knowledge through AI. If healthcare professionals only perform searches and make judgments at the same level, they will remain at the same knowledge level as their patients. Therefore, as professionals, let's utilize AI while keeping in mind that direct searching on PubMed and critical appraisal and judgment following the principles of the GRADE approach, going beyond the results of AI, are indispensable.